I'm really, really glad and excited that you all made it here for our incredible conversation on mental health. I mean, it is a big topic in 2024, but even more so for those who are diagnosed with ALS and the family, right? As a member of an ALS family, it was really hard on my uncle after his diagnosis, but it was also really hard on our entire family. And so this conversation is meant to guide that. Now, we're really excited to have Senator Cappelletti with us. In recent years, more people are talking about mental health, and legislators like the senator, she is also leading the charge. She represents Montgomery and Delaware counties, which includes right here in King of Prussia. Senator Cappelletti has made addressing mental health a top priority in her work and in the legislature. She's joined actually by our Director of Care, Steve Spaulding. We all know, we love him. Unfortunately, Dr. Mark Vanderbrecht could not be here today because of an emergency. Everything's okay, but of course, we've got the switch hitter, our absolute utility man coming in at the last minute to help us out here. So give them both a round of applause. Thank you so much for joining us for today's session.
A switch hitter. All right. That's good. There we go. I think I'm on now. So, well, thank you for joining me. Now that you know it's me that's going to be speaking and not Dr. Vanderbrecht, if anybody wants to leave, they're welcome to do so. So I know you're all here to talk about medical marijuana, but we're going to add mental health to it because that's an important topic too. All kidding aside, this is really an important topic, and the two have a lot to do with each other. And a lot to do with medical complications related to ALS too. So we're going to talk a little bit about that and then have a kind of a discussion format when we do a case review that Senator Cappelletti was kind enough to join us for, and we'll kind of discuss that, and she can share with you some of the advocacy work that she's doing with mental health and the impact it has for our folks with ALS and their loved ones. It's not just those living with ALS, it's also their loved ones, as many of you know from personal experience. So we'll be talking about that, and we'll jump right in. So what is new is old, okay? The new topic, the new issue that America's dealing with is not so new, all right? Cannabis is one of the oldest known psychotropic drugs in the world. And as you see in here, it was known in 4000 BC in China to treat emesis, parasitic contaminations, and hemorrhage. And in India, cannabis was known to be used 1000 BC for anesthetics and anti-inflammatory. And by the way, we know today that it does have anesthetic and anti-inflammatory properties to it. So pretty interesting, right? That we kind of come full circle on this. So just wanted to share that with you because I always get this idea that things just drop out of the sky and it's the first we're hearing of it. Things have been around since God was a kid. So here you go. So a couple of questions that I think would be worth talking about today. What is the research telling us and not telling us? I can tell you right off the bat that the research is not a lot, okay? So one of the things that I can tell you right off the bat is we need a lot more of that. But there is some research, and we'll talk a little bit about a few examples of research that has been done and is being done around mental health and around medical marijuana and the impact that's having specifically for ALS. And then what are we hearing and seeing? There's a lot of talk about that, and we're going to do that with our case review and our Q&A and advocacy work with Senator Cappelletti. There's a lot of discussion in our society and in our ALS community specifically about medical marijuana, its impact on pain management, for instance, and its impact on mental health, good, bad, and indifferent. And everybody in this room, I suspect, has opinions about that. And those opinions are not, I'm not here to change your opinion. I'm not here to promote my opinion. What I am here to do is to talk about all of us becoming informed to make opinions, because that is the one thing that I do insist on with people is you don't have to have my opinion. Maybe you shouldn't have my opinion. But what you should have is you should be informed to make your opinions, okay? So whatever opinion you come in with, the only thing I'll ask of you today is to be open-minded to informing your opinion with facts. And that should be true in life, right? I mean, that's just good to do in life. So whether you're pro, against, or couldn't care less, allow this to inform you, do your own research, talk to people who know this stuff, and then inform your opinion. And then when somebody asks you, what do you think of this topic? You can actually speak intelligently about it and communicate intelligently about it, okay? And you can also, most importantly, make good decisions for yourself and your loved one about this, okay? So that's really the idea that we're going to do. And then the takeaways that come from that. All right, so here's one. A large questionnaire-based survey about the real-life situation regarding cannabis use in ALS with patients was recently done in France. I tried to take some more recent research, and this was just November of last year. Out of 129 respondents, 28 reported the use of CBD oil specifically and cannabis weed, and that's about roughly 22%, relieved symptoms of ALS. Okay, now let's be more specific. What are we talking about? We're talking about rigidity, cramps, vacillations, pain, and even depression. Okay, so do you see the crossover here? You've got physical issues related to ALS, but we all know that we're one person, right? We're not divided people. So if I'm experiencing pain over here, even though that's a medical issue, it impacts my emotional world, right? How I feel about life. I can get anxious or depressed or upset by my physical situation. And nobody knows that better than somebody living with ALS, okay? And their loved ones, all right? You know that best. And that's what this is all about. So when you say to yourself, well, why are you throwing in emotional things with physical things? Yes, in science, those things are kept separate, but in real life, see real life? It's one thing, right? It comes together as one thing in our lives. So that's why it's together. Only 8 reported minor adverse reactions. So in this study, they didn't find that marijuana necessarily had any adverse effects for people, okay? Now again, what is this? This is people self-reporting, okay? This isn't somebody doing a scientific study about the properties of ALS and the substances, and what specifically they are, like anti-inflammatory properties, okay? This is a study of people's experiences with the use of marijuana with ALS. Okay, so that just gives you an idea. And somebody might say to me, well, Steve, 22% isn't particularly impressive. Well, hey, we all know what we're grasping at with treatments for ALS, right? If I said to you, we have a 22% cure for ALS, everybody in this room would jump out of your seat cheering, right? Okay? So, 22% is not nothing. Obviously, we'd love it to be 80, 90%, whatever it is, whether it's marijuana or any other substance in the world. But whatever helps people means something for them. And that's what we're talking about today. So don't get discouraged by the idea that, well, 22%, who cares? Pain management, this is a big one, okay? Most of the people that I've experienced who live with ALS and their loved ones that talk about an interest in medical marijuana talk about pain management. And again, pain management, strictly speaking, is a medical situation, right? Your doctor would say, okay, that's a medical situation. Let's talk about your experience of the symptoms of ALS and it's creating pain for you. But again, back to that first slide, in real life, right, pain management, as we all know, is tied up with our well-being, our mental health, tremendously. So in our lives, in who we are, whether we have ALS, whether we're the loved one of ALS, or whether we're just a human being walking around, we know that pain management impacts us. So let me just say a common experience, not ALS related. How many people have a great day when they have a bad headache? Not too many people, huh? Right? I don't have a great day when I have a bad headache, right? What do? We go jogging over to go get that Motrin or Tylenol, right? Because we don't like the experience of the headache, right? Because it interferes with our day, we're irritable, we're not happy, etc. So all of us can relate to the idea that our emotional world is connected to our physical world, and how we're feeling, right? The two are tied together, whether it's as minor as a headache or it's as big as getting a diagnosis of ALS, okay? So all of that connects. So this is another study just this year, 2024, entitled ALS and Pain, a Narrative Review. And basically what they did is they took 304 articles. Can you imagine that? That's a lot of review, okay? 304 articles. And they reviewed all these studies that have been done over the decades related to ALS specifically, and more broadly, the medical marijuana and its impact on people. And what they found was an enormous amount of anecdotal evidence, which means people's report of how they feel about what it's doing, indicating a positive impact for them. All right? And specifically on what? Pain management. It's not general, it's very specific. So people identify, right or wrong, they identify medical marijuana with the ability to manage their pain, okay? And I think as a clinician, and there are other clinicians in this room, you know, that's one of the most important things to me is what are people looking for with this? You know, what are you looking for? Maybe you're asking that question for yourself, for your loved one. What are people looking for? 9 times out of 10, what I hear people saying is pain management. That's what I'm trying to deal with. That's what I'm trying to handle, okay? It's not the only reason, but it's one of the main reasons, okay? What they found in all that review was there is a need for research around method of administration. You know, when you don't know a lot about a substance, how do you give the substance to somebody? You know, we know a huge amount about Tylenol. You go to get Tylenol in the store. You don't question it, right? You're like, that's how Tylenol comes, right? You go Pepto-Bismol. You get it in liquid form and you get it in a pill form. That's it. We got these ideas. How is it distributed? And what impact does it make? A lot of us don't realize that the way in which something is administered can impact the way it affects you, okay? And remember, medical marijuana is still a broad term today in the here and now. There are a lot of very specific things related to that we're only beginning to figure out and dice and pull apart in terms of the substances related to medical marijuana and what they may or may not do for folks, okay? So there's a tremendous amount of research to be done on this. Dosage. One of the reasons that physicians are, you know, not jumping in and saying, yeah, let me give you a script for medical marijuana is the dosage. Just because somebody is a great physician doesn't mean they're God. They don't just know things, right? They know what science tells them, right? And what their experience is. And for many physicians, they have no idea what the dosage would be to be effective for somebody. So how am I supposed to write that for you? I'll write it for you. Let's try trial and error. I don't know. Let's figure this out. And that's the process that many physicians do with people is it's a trial and error process of figuring out what works for you, which, by the way, is true even of treatments we know a lot about, right? But it's particularly true of something we don't know a lot about. So dosage is not a fixed thing right now. We just don't know enough to make a fixed thing about dosage. And long-term positive and adverse effects. There's not a lot of longitudinal studies, which means studying the impact of something over the long term, okay? So sometimes we find that when people take a particular substance or use a particular treatment over the long term, it has enormously positive effects. We're like, great, we should do more of that. And many of the treatments you and I benefit from in modern medicine are the result of longitudinal awareness and studies that indicate that this particular treatment is very, very successful in helping people, okay? Good example, just a common example for people. We write it all the time in clinician world. PTOT, physical therapy, occupational therapy. Everybody needs it. Get it. Get that OT out there. Get that PT out there. We don't even think about it. It's just common, everyday thing. Oh, you're leaving the hospital? Get you some PTOT, you know? Oh, you're not feeling great? You lost a little bit of your limberness? Some PTOT, right? PTOT, physical therapy and occupational therapy, isn't just something we throw out there for the heck of it. It had longitudinal studies and experience by clinicians that indicated that it works. It is successful. It is impactful, right? So they did it, and it made a huge impact. Now, here's a non-adverse one. When I was growing up, my parents smoked, and everybody else smoked. The whole world smoked. I don't think when I was growing up, I met an adult that didn't smoke. So it was just a thing, right? Decades ago. Not so much the case now, right? Because what did they discover? We all know. The Marlboro Man went down, then everybody started going down. And we're like, ooh, this is not good. Things didn't work out so good with that. The longitudinal studies and the longitudinal experience of people was, this didn't work out so good. So something that people decades ago thought was, it's an innocent enough, fun thing to do, and I enjoy it, and it makes me feel good, later found out, not so good for me, okay? And hey, some people are just like, I don't care if it's good for me or not. I want to do it. That's okay. It's a free country. But I'm just saying there's two examples of a positive and a negative longitudinal experience and study, and we don't have those with medical marijuana. So we need to work on that. And then there was an additional study in 2023 entitled Cannabis as a Source of Approved Drugs, a new look at an old problem. And they came to similar conclusions, that basically we are on the precipice of just beginning to explore the possibilities and the impact of cannabis specifically, and all those elements and what impact it can make. So what I thought we would do now is do a little kind of case study, and Senator Cappelletti and I are going to kind of join you guys in a conversation about the experience of deciding, is this something for me? Is this something I want for my loved one? What is my opinion about this, just in general, you know? And remember what I talked about earlier in terms about informing your opinion, right? We all have opinions. Is that an informed opinion? And you know what? It's okay to say, we don't know enough about something. I don't have an opinion. I do that. I told some guy the other day, he looked at me like I was un-American. I said, I don't have an opinion. He said, well, what do you mean you don't have an opinion? I said, I don't know enough about it. I can't give you an opinion about that. And he was like, oh, yeah. So you don't have to have an opinion if you don't have an opinion, okay? I give people permission to walk away from an opinion if you need to, okay? It seems like we have to enforce that somehow in our society, that everybody has to have an opinion in 5 minutes, okay? So you got 5 minutes, make up your mind, what is your opinion? You don't. So, all right, so here we go. Case review. This is not a real person, by the way, just in case anybody's like, you know, I know this guy, you don't. You never met Doug. He doesn't exist, okay? All right, so as his ALS progressed, Doug was experiencing an ever-increasing level of discomfort. Sometimes he identified it as pain. It was impacting his quality of life, and Doug was becoming depressed as a result of the experience of his discomfort and pain. Losing interest in going out and being social. He used to be. He was a guy who went out, enjoyed getting together with people. Now he was kind of like, just leave me alone. I don't want to be bothered, right? He didn't feel like himself. He just didn't feel like he was the person he was. A friend, who's also living with ALS, told him they had started using medical marijuana to treat similar problems. They felt it was really helpful. Doug wasn't sure what to do next. So, let's start a conversation.
So medical marijuana, I think you guys know a few years ago, a little more than a few years ago now, we passed that here in the state legislature, and it's really specific in Pennsylvania about the ways in which you can consume cannabis. It's specific, like I know explicitly edibles are not a part of this because we have a bill to try and add that into the things that are approved to be sold in the medical marijuana facilities. So the thing I think this case study leads me to think is, because we have that here in Pennsylvania, talk to your doctors. And you made a great point earlier, Steve, about not disconnecting the mental and the physical. Make sure you're talking to your doctors about all of those things. Which doctor do you feel most comfortable with? And make sure that they're connected and have access to the mental health or the physical, and how does that all interplay about medical marijuana. It might not be right for you, but maybe it is right for you. And talking with the experts, the people who can prescribe it for you and help you get that card, are the people you should be talking to see, is this going to help? And you saw from some of the studies, it certainly helped quite a few people. There were others that maybe it didn't. But it's not gonna, it's not gonna hurt to have that conversation and figure out, should I try it? I think that's kind of where I'm at when I'm thinking about this and my role as a legislator.
That's great.
Yeah.
Thank you. And by the way, I think it was said earlier, but Senator Cappelletti has been a great advocate for mental health, which is really important, especially with ALS. It's something in our society that is we're talk about hitting just the cusp of it. I talk about the cusp of medical marijuana. Well, we're at the cusp of mental health. That's this topic that's been floating around there all our lives and just hasn't really gotten the light of day, right? Yeah.
No,
So.
that's to be specific into the mental health stuff. I mean, we have a lot of funding that we're trying to get out there to increase the supports, because it's a combination of stigma, reimbursements for people who do go into that profession, and what does that look like for them through insurance. It's a multitude of issues. So we have that piece of it, breaking that stigma and making sure students, so if you guys have, kids or grandkids, nieces or nephews that are a part of this family and feeling the weight of what might be happening with an ALS diagnosis for their loved one, that we have a bill that would help give them mental health days from school, so that that are separate and apart from your sick days, so that you can say, I'm struggling, I can't really going to school is not something that is going to help me today through my mental health, and that they can use those days. So we have some of those types of pieces of legislation that we're working on, have been introduced, and we're really hopeful to try and get through as we see a mental health crisis of what's happening in our country right now between COVID and some of these other things that have been going on.
Yeah. Okay. And I think one of the things that's really good that you just mentioned was the stigma. I run into that a lot. My esteemed colleague, Gail, is in the back hiding out there, and she and I know very well, and my whole team does, that we come across all the time people who are struggling with significant emotional mental health challenges. They got a diagnosis of ALS. Their ALS is progressing. Their loved one has ALS. And that doesn't necessarily mean their spouse. It could also mean their parent, their grandparent, their aunt, their uncle, their sibling, their friend. It has a kind of impact across the chasm. But because of the stigma, people don't want to talk about it, and they certainly don't want to engage in a whole conversation with their doctor and the world and everything else. And what do you do about it, right? Like medical marijuana and other things. So one of the things that we wind up spending a lot of time talking to people about is it's okay to talk about this. It's okay to talk about what you can do about it. Because the first step is to say, I have something going on. And the second step is to say, what am I going to do about it? You're not going to do anything about something you aren't willing to talk about. And the other thing that people say all the time is, don't out me. Because even though we live in a very, I'll call it open society, supposedly, in the 21st century, we're only open about certain things, right? Like somebody else's mental health issues is fine. Oh, I'm all supportive of that. That's great. Well, how about you and your family? Oh, shut the door, shut it down, close it all up, cover the speakers. I got nothing to say about that. So, the stigma is not really gone, right? It's just sort of dropped below the surface, just below the water, and it's there, right? Yeah.
Absolutely, and I think even just in my experience in talking to people about seeking, mental health services, finding a therapist, things like that, what I would suggest is don't let that first experience be your only experience. If you didn't connect with your therapist, it's like finding a dentist or a doctor of any kind. I have been through a lot of dentists. I'm not a big dentist fan. I finally found one that I feel comfortable with, and that's my person. It took a while to get there. It could be the same thing in finding a therapist, because you want to find somebody that maybe can relate to your own life experiences, somebody who maybe has had a loved one going through something like this, somebody who maybe has an identity that is similar to yours, whether you're talking about racial or Otherwise, what that looks like, there are so many people out there that you can choose from, and find who you're comfortable with. It might take a little bit of time, but it really is worth your own physical and mental health to go through that process and find somebody that you can lean on and help give you perspective and supports and learn how to cope with what's happening.
That's great, and I have a funny story about that. I can relate to you on the dentist side. So I think I told my team this, so you guys will just have to bear with hearing the same old story. But so very briefly, for years I avoided the dentist at all costs. My wife would schedule the appointments, and I would find something to get busy with to cancel them on a routine basis. So finally she schedules an appointment, and she tricks me so that I don't know that it's there and I don't have time to schedule something else in. And then all of a sudden the appointment's upon me. She's like, "Oh, look, your appointment's here. You're going to have to go." So I wind up going to this appointment. Now, unbeknownst to me, she had prepared the people at the dentist for this maniac who doesn't like dentists, right? And so I walk in, and they're looking at me like, "Are you okay, Mr. Spaulding? Everything is all right. Why don't you sit right here?" And they are handling me with white gloves, and I'm like, "What is going on here?" Well, I find out later, of course, my wife has explained that he's a little off, and you're just going to have to really work with him, because he doesn't want to be here. So they're expecting me to bolt, which I did not, and do all sorts of things. So in any case, I just share that funny story about, we all have things we're not comfortable with. We all have things we don't want to address and handle, but we need to, right? You need to see the dentist. You need to handle your mental health. You need to look at the options that help treat whatever your challenges are in life, whether it sounds good or not. And that brings me to a different topic, and that is the whole issue of getting help that we don't like. Okay? Medical marijuana is its own thing, but for me, my experience clinically, it falls under the same thing as saying to a family, your loved one or you might need a psychotropic med, an antidepressant, an anti-anxiety medication, or something like that. And then you get the look. And they look at you like, "What?" And that is not what I want to hear from you, sir. And so, that's a whole thing, right? Because now you're back to that stigma. Are you saying I'm crazy? No, I'm not saying you're crazy. Well, then why did you say I need an antidepressant or an anti-anxiety? Or why do I need to talk about medical marijuana to treat my pain or, my emotional response to ALS and what I'm dealing with? I'm not crazy. So there's a lot of getting past the assumptions we immediately jump to, right, about what people are saying to us. So when clinicians or family members or anybody says, "I think you need," it's hard for people to say, "All right, let me just calm down and hear you," instead of, "How dare you accuse me of being crazy?" It's a thing, and we all live it. Again, it's fine for other people to have their mental health. With me and my family, that's a different issue.
I actually want to take a moment to talk about the fact that we have a lack of studies here in America, and that has to do with the federal law and the way we schedule the drugs. And marijuana is still considered a Schedule I drug, where we cannot put any federal public dollars towards studying it. But here in the southeast of Pennsylvania, we have some incredible institutions that are trying to do studies, that are finding ways to fund this, to understand the impact of medical marijuana on a variety of issues. So as we continue forward with the more anecdotal evidence, some strong studies, but that they're small groups of people, they're self-reporting what's happening. As we develop stronger and stronger studies in some of these smaller things, as we start to learn more, hopefully what we can see is a shift in the way that our federal partners will consider marijuana, and we might be able to reschedule it to consider it in a different way, as well as being able then to maybe put more state dollars into understanding these things, because we have a lot of great institutions that could get a lot of work done and help us better understand the different ways that you can consume cannabis, because it's different when you say medical marijuana. There are different ways, as I mentioned. You're talking about rubbing the oils into your skin to help with maybe joint pains that are happening is not going to react with your body necessarily the same way it's going to be if you're taking it orally in some fashion. So I think that, understanding those different modalities is going to help, and that is a change at the federal level that, I'm hopeful for the future that we're going to see as we continue to have people making the case, like these types of advocacy groups, that we need to know and understand more to help individuals with these types of diagnoses.
It's great. It's great. All right. So back to Doug, who is not a real person. If there is a Doug in this room, I am not outing you. Okay. I just want to be clear. All right. So, you've had a chance to hear us and look at what I've proposed here. What do you think Doug should do? What do you think? What are some of the questions that you would ask if you were Doug or you were Doug's loved one? That you would want to know, that you would want to explore or understand about this?
Having ALS and being on disability or a fixed income, and it costs money to get medical marijuana. You go to the dispensary, no one cares what you have. It still costs money to get it out of there. Say I go through an ounce a week, all right, or an ounce every 2 weeks. It's a lot of money. How do we continue to afford that with our income? Not everybody has a partner that does better than them, So what do you do? You get your insurance covers painkillers and whatever else they give you to this pharmacy.
That's my job to change the laws. And like I said, unfortunately, I think, I don't know actually how that could look. Yeah, to change the laws so that insurance will cover it. And I don't know, to be honest, I don't know if there's a way, if there's the ability, because it is a Schedule I drug at the federal level, to change the law at the state level for the insurance coverage change. But that is the problem right now. Absolutely.
You get Percocet and you don't
I
have
know.
a prescription, it's a skip. You go to jail, you get a fine, whatever happens.
I know.
Do you know what I mean?
Oh, no, it is very.
No money down at the
Yep.
CVS or whatever.
Yep.
Yeah.
It is.
It's kind of like, yeah, let's go forward with this, but do you have the money? No. Kind of like the rest of the world.
Yeah.
You know what I mean?
Yeah.
I'm so sorry, but yeah, it's the unfortunate situation we're in, and you make very valid points as to like what is happening and how the opioid crisis kind of gets entangled into this, because we can get opioids through our physicians, but we can't get medical marijuana, and we know that one does significantly more damage than the other. So yeah.
I live in Jersey, but can you guys grow plants here in Pennsylvania?
Nope. That is something else that we are actively working on changing. And, one of the reasons there's a lot of back and forth in the state legislature right now on opening back up medical marijuana legislation to change some of this stuff, because there is a growing number of people who want to have home grow listed as something that they can do. So that is another option that we're really trying to work on, is adding home grow, so that instead of having to go to a dispensary, you may be able to just grow it yourself and utilize it that way as well.
And even, maybe some people aren't physically able to do it, but
Yeah.
there's a lot to say about all this, but
Yeah,
in the interim,
I know.
you know what I mean?
You all are
So much
hurting,
you
and
can
it's
do.
not fair.
It's one of the reasons I moved back home. I was in California for 10 years, and then things started to get bad, and I moved back home. Just one of the reasons, not,
Yeah.
of course, like my family and all that, but, before
Yeah.
it got bad, this got bad, I was growing it. It would help me survive, I couldn't last at my job much longer, so then I found out what was going on.
So it seems like a money grab at the expense of the people who need.
Jane, I don't think I would dispute that.
Yeah.
ALS does affect the brain tremendously. And when you hear the word marijuana, you don't even think about mental, you think about people getting high. So I want to know medically, what does medical marijuana do for the brain? That we're not looking at, because we're, even though we grew up in that era, we're not marijuana people. So other than the thought of getting high, excuse the expression,
No, it's
what does medical marijuana do for someone that does have that? How would it affect
Well, that's a great, you always ask great questions. No, that's a great question. And that's exactly what I was talking about, being informed. You know, before you have an opinion or make a decision, be well informed, because everything has positives and negatives. Everything that we use has positives and negatives, and you need to know what those are, right? So when it comes to the impact on the brain, you know, that is the kind of thing that, I think you mentioned it earlier about, you know, sitting down, and I always tell people specifically with your neurologist, especially if it's related to your ALS and your pain management, but you can sit down with your primary as well, and just have that conversation. Now, understand that your physician has limited knowledge too, because there is limited knowledge, right? So your physician isn't going to be able to give you a godlike kind of Anno Domini, you're good kind of thing, you know, but you can have a conversation with somebody who is as versed as anybody can be on the impact of your cognitive functioning versus the impact on managing your pain. And hey, the truth is, we all know, you don't have to be a neurologist, there is trade-offs, right? There's trade-offs with everything. You just mentioned opioids, right? You know, one of the reasons, talk about longitudinal studies, right? We used to give out opioids like it was candy. Oh, here you go. People love them. Give them more, you know? And then all of a sudden, now we got a big old crisis on our hands. Again, longitudinally, didn't work out so good. But that didn't mean that opioids didn't have a place, right? It just meant we needed to control that sucker and make sure that you have it when you need it and you don't get it when you don't, right? But to your point, it's paid for, right? So, you know, exploring that, you know, as a system and discussing advocacy to support these things in research and in access, and then also as a patient and a loved one of a patient saying, I need to sit down with my physician and say, can you tell me what you know about the positives and the negatives? And you know, because we've had these conversations, everybody with anything, folks, any of us, whether you have ALS or not, whether you're 20 or 80, you ought to be going into your physician and asking, what are the positives and the negatives of this treatment or this medication or whatever it is that you're proposing or that I'm thinking of myself, okay? Because everything has it. People say, no, it doesn't. Aspirin does, folks. Aspirin does.
And I'm going to go back to what I said at the beginning, when I first started speaking about the studies. Like, we can't know as much as we do about aspirin, about marijuana and its impacts, because of the way it's regulated at the federal level right now. So if we want to start having studies, and unfortunately, like longitudinally, it's going to take a long time to truly understand and give you more information and have a much greater understanding of the different impacts, positives and negatives that it'll have. It's going to take decades of understanding, and we haven't even truly scratched the surface to start that, because of the way the federal government has it scheduled. So to even be able to, for doctors to be able to give you, I think sometimes the answers you might want to hear, they just don't have the knowledge base because we won't let them.
I know that with ALS,
Yeah.
and
Yep.
so I was just wondering,
Yeah.
or Steve, different scenarios of how it has affected us.
Yeah. I don't know personally. I just know that hearing anecdotally from a few people here that it's helped with pain management. That's mostly what I have heard when it comes to the use of marijuana.
Thank you.
You're welcome.
With that, you know, I've tried everything they want to throw in front of me, you know, Meloxicine, a non-opioid, a non-narcotic. And some of those things threw me off, threw my balance off the next day. Or, you know, just like some weed stronger than other weed, there's actually strains that don't get you high, that just promote the CBD inside of it. There's more than just CBD. There's so many different variables in marijuana that won't get you high to help you meditate. If you just ask people that are experienced, that you trust, you can start from there. The doctors really don't know much. And that's a sad fact. And I understand you don't want to be high. That's something there's other ways to go about it, safer ways. You know, and you're welcome.
So, Senator, folks are passionate about seeing marijuana change from the Schedule I drug. How would they communicate to their representatives? Which representatives should they be communicating to? too, that they want to see this change and want to see their elected officials working on this.
Certainly. So this is a big deal. So I work out of the state capitol. I'm a state elected official. And as I said, this is the federal government. So you're going to need to go to your congressperson or your U.S. senator. So like here in Pennsylvania, in the Southeast, it would either be like a Mary Gay Scanlon, a Madeline Dean, a Dwight Evans, a few other people down in this area, or Bob Casey and John Fetterman, to sit down and have these conversations with them. I imagine, Tony, you create advocacy days to go down there and talk to these guys about this issue and having the importance of having access to changing the schedule so that we can get insurance coverage, we can get the studies to understand and know how the different modalities of cannabis and CBD and THC impact somebody, especially with ALS. So those are the people right now. I think I only know, I couldn't tell you any of the other senators out of like some of our neighboring states. I apologize. But like you'd want to go out to those individuals and really make a showing.
Great, thanks. Anybody else? Any general questions or things that people just want to ask or talk about?
There are like some studies, not with ALS, but like more depression, studying like ketamine and LSD. And even in Philadelphia, I know they're trying to do ketamine studies. I mean, those are controlled substances. But I don't know the law specifically, but I assume that those are more heavily controlled than they're not more heavily controlled.
Not necessarily. If there are federal studies, I don't specifically know where ketamine. I think ketamine is probably a Schedule II because it has a lot of a place in it's had its place specifically in veterinary practice. So anything that has a place to be prescribed is a Schedule II drug or less or lower. Anything that's Schedule I is going to be like your heroines or your cocaines. Marijuana is listed on there. Those are the Schedule Is that are just illegal. Period. End of story.
Yeah. But you bring up an interesting point that one of the things that we learn with ALS that has kind of shown the whole world. ALS has set the tone for a lot of big changes in healthcare in general. We helped establish the interdisciplinary clinic model that has become the gold standard for healthcare across the entire world. It's an extraordinary achievement, right? Because ALS is so big and so important for the people it impacts, and it motivates people to do so much. Because of that, it also brings to everybody's radar the reality that we need to explore every avenue we can to help folks, that nothing should be off the table in terms of what we look at and explore and research and understand and try to make accessible to people, as long as we know enough that it's safe and that it makes an impact, right? And so ALS has demonstrated that in spades for people, and I think across the board, and this is just another example of that. See a hand up back here.
Are there patient assistance programs that can waive the medical marijuana fee for the card? I believe some states may have something like that if you qualify. It doesn't do anything about the actual purchase of the products, but it might waive the fee for just the card, which is $50, minimal in the grand scheme of ALS costs, but it's $50. So I'm just curious if you're familiar with any programs, if they might exist for something like this or not.
Not off the top of my head. I see somebody shaking their head. You don't think there is?
My doctor, they take care of all that.
Because she's on disability.
Okay, so if you're on disability in Pennsylvania, you can get the fee waived.
Okay. Good question. Yes.
Are you gonna be too able to talk about the mental health portion of I know the person is easier.
Yeah, just mental health in general you're talking about? Just getting back to that? So yeah, I would just say, to just circle back to that, we talked a little bit before, as you heard, about trying to make sure that people seek mental health And that's a big part of what we do for folks, is trying to get them to just be willing to talk about it. Because remember, we think of people's issues with mental health being about other people, right? You have a bias that mental health is a taboo with other people. We don't think about the fact it's a taboo with us. I don't want to talk about it. I don't want my loved one to talk about it. So it's not just a taboo in general, it's a taboo that's very personal. And so when you're sitting in front of that person and talking about that, that's a challenge. And mental health with ALS is something that once you can get past the I don't want to talk about or acknowledge it, it opens up the door to really get into a conversation about the whole impact. Like for instance, if somebody says, I have ALS and I'm depressed, should that be a surprise that I'm depressed? It shouldn't be. But you know who's surprised? Me. Why am I depressed? Well, 6 months ago you got a diagnosis of ALS. Yeah, but I don't know why I'm depressed. It seems obvious, but it isn't, right? And most importantly, it isn't obvious to the person who's struggling with it. And that's part of the process, right? Or I'm anxious. I have this tremendous anxiety that's kind of taken over my life, and I don't understand why. If you can get past the conversation of I don't want to talk about that to what's going on, you start to discover and help people see it. And that's typically often a combination of counseling and medication for more severe symptoms. So for instance, and again, longitudinal studies have proven this again and again and again, the combination of counseling and psychotropic meds for people who are struggling with more severe forms of depression and anxiety is highly effective. It's highly effective for people. And in many cases, people ultimately taper down and come off of the antidepressant or anxiety medication with counseling. Now, with somebody living with ALS, they may stay on that for the rest of their journey because they're living with ALS. There's no resolution to that, But that's a good rule of thumb for everybody, including a person living with ALS.
And I'll step in just a little for a moment here, just because I've talked to you a little bit about the money we want to infuse into all of this, and that's the important piece because we're talking about a workforce shortage, not necessarily having enough clinicians to help with the mental health crises that we're seeing today, let alone individuals who have just been, seeking help all along. But then we talked a little bit about insurance today. Does your insurance cover it? Okay, maybe your insurance does cover you going to get mental health supports. Are there caps on that? How many times a year can you go? What does that look like? What's the reimbursement? And I said this earlier. What does that reimbursement rate look like? Because for a lot of mental health professionals, they don't end up taking insurance because they get reimbursed so little. It's not financially feasible for them to do it, to take those patients. So that falls back again onto me and my colleagues, and I just want to highlight that those things, I'm in the legislature thinking about those things. I know I have colleagues in the legislature thinking about those things who care and want to address those issues so that you don't have to concern yourself with, am I reaching my cap? Do they take my insurance? Can I find somebody around here that takes my insurance that can get me in when I need to be in? Because there's also a lot of waiting lists for individuals that do take insurance and things like that. So I'm highlighting that as things that are happening, conversations that are happening, and the things that I'm fighting for up in Harrisburg. And I know I have colleagues fighting with me, and I know that we have colleagues in Washington, D.C. that also want to see these changes on a much broader scale.
Yeah. Tony.
Marie gave me a thought of a good question for you, because our patients come to a clinic their first time, they've been coming many times after that. When is the best time that they should come to one of our social workers or nurses to ask about mental health for themselves, the patient or a caregiver, and what kind of services, how would our social workers and nurses help them?
Yeah, it's a good question. Thanks, Tony. So, one of the things that I definitely encourage folks to do, and I hope you do and I hope you will do it, is, our team does will help anybody who wants to get help for their mental health. And if you don't want to call it mental health, that's fine. I want help because I'm a little off. I don't argue with people about the terminology. I don't care, right? If you're a little off, that's fine. Let's talk about being a little off. You know, whatever the terminology is that you're comfortable with, at the end of the day, the point is to help you. So if you're in clinic and you're thinking, hey, I'm really struggling. I'm the caregiver for a loved one and I am isolated and down and I don't know what to do with myself. It's okay to take a moment and speak with one of our social workers at clinic. And if you don't want to speak in front of your loved one, that's okay. Take a minute. We've had people do it. You step outside, hey, Janie, could I talk to you for a minute? Janie will talk to you, you know, and help you, okay? Steve, could I talk to you? Gail? Talk to Gail. She'll keep you for an hour. No. Yeah, go ahead, Jill. Yep. Right, right. So if you don't want to speak in front of your loved one, either because you're living with ALS or you're the caregiver, and you don't want them to worry about you, because I hear that all the time. Well, I would have said something, but I don't want my loved one to worry about me. It's okay to speak personally. And as Gail said, if you don't want to talk at clinic because you don't like public, you know, set up a home visit. We'll set up a remote visit if you're not up for a home visit, whatever it is. And we, by the way, do help people all the time with their mental health, okay? Talking about it, helping you figure out how can you get help, you know, navigating the logistics, the practicalities of getting help that you were talking about, all of that. We do that all the time. Every week, me and my team deal with those issues every day, often multiple times a day. So this is normal.
As well. So if your insurance doesn't cover it, just like any other type of diagnosis or things that we deal with, drug, alcohol, support groups can be really helpful because you're on a journey with other people going through it. So we have 13 support groups for which there is no cost. And I run a caregiver group. So, I mean, there are resources out there in terms of mental health. And, you know, if you're struggling beyond the group, then we can help you find a therapist that's maybe in network or works within your parameters. So take advantage of all these different resources that are out there. You don't have to go to an ALS, you know, therapist. You know, you might want to just deal with someone that deals with the issues that impact ALS. So, I mean, these are really ways, you know, different people, different strokes for different folks. And we can't push you because the more you push somebody who's not there, then we're gonna lose you. So we all have to be mindful where we are on this journey, and when we want help and when we don't want help. Mm-hmm. And the love of your family, of your caregivers, will help determine that. Maybe the individual's not ready, but maybe a caregiver is. So, you know, there's so many ways to get that kind of help.
I want to just something very different, but I recently had a baby. She's 13 months old, and after giving birth, I had trouble breastfeeding, and my insurance actually didn't cover my lactation consultant, but they offered free support groups for new moms struggling, and I went to that weekly, and it was just nice to be with other people who understood. It didn't have to be the exact same problem, but you know, it was just nice to be with others. So I just want to put a plug in that support groups really can, if you're not quite sure what that first step is, a support group can be a really good first step in helping you manage whatever it is you're going through. So I just wanted to put that plug in on how important support groups are.
Thanks for sharing.
Yeah.
I don't know how many caregivers are here, but I'm going to say the moment that your loved one is diagnosed, you need to reach out to, because we don't know what to do, and we can get on the person's nerves trying to do what we don't know what to do. I'm learning ALS every day, but I know the team here are the best, and there are many, many moments were struggles for me because it hurts me to see David in any kind of pain or going through any kind of struggle. And so when you don't know what to do and there is someone that understands and is willing to listen, her group is wonderful, Steve is wonderful. I feel like you all have made me feel like family. And this is just as hard for me as a caregiver as it is for my husband in being diagnosed with it. As far as I'm concerned, we were both diagnosed at the same time. I don't have the disease, but mentally, you are carrying the disease. So always reach out as soon as we can. Because you really don't know what to do. There is no ALS 101. So reach out as soon as you find out or as soon as your loved one is diagnosed. Don't do what I did. I Googled ALS.
Oh, no, no.
Please reach out. Our loved ones, our family, our children, they don't really want to do it. They don't understand. So do reach out to someone professional. I suggest reach out right away. Because when they tell your loved one they have ALS, they're also telling you. So you need to know what to do, especially what not to do to get on their nerves. So I asked my husband to make me a to-do list. So, you know, reach out right away. This is the best team ever. And how much is I going to get paid?
She's a plant. She's a plant. No, that's great. Right. A lifetime supply. Right. So, folks, just to kind of wrap up, and then I know everybody needs to take a break. So basically, some takeaways. Medical marijuana has a lot of potential that should be explored. It is an important avenue of ALS research, which I think she spoke to very well. It may be helpful in managing discomfort or pain, consequently improving quality of life for some folks. And then consult with your neurologist, we talked about, to understand the known and unknown benefits and risks. And I will say thank you for the comment about Googling ALS. Please go to our website or other reputable sources. You do want to inform yourself. You do not want to inform yourself with nonsense, which we all know is also out there. So, I've had many people come to me and say, Steve, I read about this cure, in Bolivia. And I'm like, no, that's not real. So just, try to look at your sources when you educate yourself with anything. These issues, any issue, it's important to know that the information you're getting is actually true and researched and known and not just somebody's opinion, So thank you for coming. This was a great conversation. Thanks to the audience, my team, who are always great, and the plant and everybody. Thank you.